I think we need to have that conversation. I think it's, you know, people need to understand that we got to phase 2 because everyone did their part. Everyone has a responsibility to do their piece, and everyone did. And we brought cases down. We were able to move from phase 1 to phase 2. What has happened is when we went to phase 2, a lot of people forgot what they did, and they just went back to doing what they normally do. And so we're trying to encourage people to say, please, you know, do your part, take the responsibility, and see if we can bring this down. At a certain point, if we can't bring it down with that, we're going to have to look at other measures. I mean, we hate to do that, but, you know, we just can't let this keep going up. And we need to have those conversations. And it's hurting our community. It's hurting the businesses. It's really not accomplishing what we want to do. And do we move it backwards to like a 1.5 or something? I don't know. And I can tell you, if we don't decide to do it the way we want to do in this county, at some point, you know, the governor or someone else might tell us what we need to do. So we definitely need to have those conversations. Yes, I think, you know, we've been working with schools for a while, and all the schools have been doing work. And there are two issues that we're working with them on. One is, how would you reopen if you could reopen? And this is where, you know, OSPI, CDC, you know, there's been a lot of guidance issued. We still need to continue to work on them because there's some areas where it's not 100% clear. There's some, you know, but anyway, it's more procedural, right? And this is something which the staff at Tacoma-Pierce County Health Department, Public Health Seattle King County, and Snohomish Health District have been working on together, because we know that our media markets are the same, our school districts border each other. We're trying to help them through this process of working on the guidance. And you know, we're working with Department of Health and OSPI on that. And as I said, that's a little bit more concrete, it's more circumspect, it's easier to deal with because it's procedural. And you know, in some ways, like many of the things we do and the schools do, which are regulatory. On the other hand, the big issue which led to my letter last week is it safe for kids to be back in school with in-person instruction? And right now, the way that our cases are going and the widespread community transmission is just not safe. I mean, we, as you know, everyone worked really hard together, and we were able to bring the cases down in April. It wasn't always the smoothest because we hit these stubborn plateaus. We were hovering around 20 to 35 cases a day for about a month. Then we came down to about 10 to 15 cases a day. Well, in the past week or two, we've gone triple digits like 4 times, and we are way higher than we were in April. You know, one of the metrics that the state has used, which is how many cases have you had in the last 14 days and what's that rate per 100,000? As you know, when we went from phase 1 to phase 2, the state was looking at 25 and we were 16 at that time. So, you know, we didn't have an issue. But then in less than 2 weeks in June, after we went to phase 2, our cases started climbing. It's pretty much been a straight line up from there. We are now at 141 per 100,000 in 2 weeks. I mean, that is just way above that 25, you know, target that Department of Health and the governor had set. And it's still going up. I mean, our average daily case rates have been going up. You know, we'll have to see, because every few days it looks like it might flatten, but then we get surprised again. So that's the context. And what that means is there is widespread community spread of COVID-19. So it is, at this time, it's not going to be safe to have groups of children together in in-person instruction.
Mm-hmm.
Yeah, we've had conversations yesterday. I met with the Catholic schools, and then in the afternoon met with the Association in Independent Schools. And I think what people need to be aware of is what were people planning for and what is the reality now. I think a lot of schools were hoping to be able to be open for in-person instruction in the fall. I don't know how many now are still planning to after they've heard my recommendation on this. And I think the reality is, when you look at what the experts think and you look at the experience around the world, when you have your community cases very tightly controlled, and the US never really got it down that low. As I mentioned, we got it down in Pierce County to 10 to 15 cases a day. I mean, there are other parts of the world where they're down to 0 cases a day, right? And nationwide, they're like in double digits of cases. When you are able to bring cases down there and keep it down there, it's fine for you to have kids in school. When you've got cases in the triple digits like we're having now, it is not safe. So when there is a lot of activity in the community, it's not safe. And so I know everyone had to plan. Part of the reason that the letter went out last week is, schools are or have been planning for opening in the fall, and I can't tell you what's happening next week. I certainly cannot tell you what's going to be happening on September 1st. But they needed to plan, and they needed to have a clear indication of what my recommendation was. And my recommendation as of last week and today is it's not currently safe to do so. That's a good question. I mean, we don't report most of what we're doing in terms of the businesses. It just says, if you remember when we started reporting cases throughout the county because people want to know where they were, there were some parts of the county where the cases were low enough that you could guess who these people were, or at least people would try to guess who they were. And that is not what we want. We don't want people stigmatizing other people. We don't want people avoiding businesses because they heard that the business had an outbreak. We have seen this. I mean, we had 3 restaurants that had norovirus outbreaks, and they, in that they only have to close for 24 hours to sanitize. Well, in those 3, they either changed their names or they closed, right? And these were restaurants that had been in the community for a long time. We do not want to see that happening, right? Our job is to protect the public's health. It's not to put people at risk of being stigmatized or having rumors about their names, So we want to be able to protect that, and at the same time do what is needed to help these businesses control the outbreaks. But I think the important point is right now, I mean, same things we're saying about schools, COVID-19 right now, it's widespread in the community. I mean, yesterday we were working with 22 new businesses. Okay, and it's not always that high, but it's not unusual for us to have like 20 businesses we're working with. We had 3 new long-term care and congregate facilities, right? Someone pointed out to me, I mean, like hardware stores, they've been open the whole time, right? They were essential businesses. We did not used to see cases and outbreaks in hardware stores. Now, yep, we're seeing cases in hardware stores all the time. They're not doing anything different. What it is there's so much disease out in the community. People are coming in and getting their employees sick, or their employees are going home, hanging out somewhere, and they're picking up the infection. They're coming to work, and then the employer finds out they're sick. It is widespread. And the same thing I'm saying about schools. When the community spread is high, you'll get it in schools. And we are seeing when the community spread is high, it goes to the businesses and it goes to the nursing homes, right? That is the challenge we're facing. When there's so much infection in the community, wherever people are going, they're going to expose themselves, they're going to expose other people, we're going to see cases. It's just that we happen to, with businesses, they're required to have a response plan, and they consult with us. And so we are helping them to control the infection. And, you know, we can think about whether we can do some, you know, lumping, you know, but I'm not sure what the public would do with that information. Like, I mean, sure, there restaurants have outbreaks. So would you not eat at restaurants? You know, nail salons, would you not get your nails done? You know, but, you know, we can think about that suggestion, you know, but again, our focus is on identifying the cases, isolating people who are sick, quarantining those who have come in contact with them so they're not spreading the disease. Yeah, thanks for that question. And this is very important for people to understand. You know, the reservation and the tribe are not in my jurisdiction. Okay, geographically, it looks like they're you know, they're placed within Pierce County, but they're, you know, they're a sovereign nation. They have their own health authority, and you know, I can't tell them what to do. However, we do have good relationships with their health authority, and you know, uh, when they were having issues with getting testing supplies, we made sure we got it to them. It's no different than during the H1N1 pandemic. We made sure they got vaccine. Regarding the casino, I don't want to speak for the casino, and I certainly don't want to speak for the tribe. I can say that, you know, from how I understand it, you know, the casino is a division or subsidiary of the tribe. They consulted with the tribal health authority, which is, you know, kind of a different division of the tribe. And, you know, the medical director had opportunity to give some input. Regarding the smoking, you're absolutely correct. This is something that, you know, we would support, that not only is smoking dangerous to people and the people around, you know, the people who smoke and the people around them, but we are very concerned that because we know the lungs are one of the key entry points and sites of infection for the coronavirus, that we want to avoid situations where people are otherwise increasing their risk. And we know smoking and vaping and things like that irritate the lungs. We know that those people are more likely to get colds, pneumonias, whatever you want. I mean, it's impairing the function of the lungs and the airways. And we have seen other tribes do this. I mean, other tribes reopened their casinos, banning smoking. I think the point that was made in the article was, are people using smoking as an excuse not to wear the mask? Because that was an exception carved out. And you know, you can't eat or smoke if you're wearing a mask. And so I think there, some people may be exploiting that. And so both for practical enforcement reasons, you know, not giving people an excuse to not wear a mask, and for just health reasons, I think it'll be a great idea for the tribe and the Emerald Queen Casino to consider banning smoking. I can't go in my official capacity, right? It's not my jurisdiction. I have no power over what they do.
Right,
Understood. I cannot go in an official capacity. As an individual, would I go into a smoking facility? No. I mean, I grew up at a time when they allowed smoking on airplanes, when they allowed smoking in restaurants. It is just unpleasant. My son has asthma. My wife's got mild asthma. We're traveling once overseas, and my wife went to an asthma attack on a bus because we were in a country where, you know, they didn't allow smoking on the bus, but people would smoke outside bus and come in and would have, you know, smoke all over their clothes. So yeah, I really don't voluntarily go into any place that allows smoking.
Understood.
So let me be clear. We're in a much better place now than we were in the spring. Okay, so we are doing a lot more testing, and we're doing this in a multi-pronged way. You're aware that the county has purchased mobile testing units that go around, and they've been doing sites throughout the county. You can go to our website and check on, you know, on the testing sites, and it's not just the county mobile units, but it's all others. We're also working with the healthcare systems to increase their capacity to be able to test. So, if you went to your provider's office, or many of our healthcare systems do have publicly accessible testing sites. So all of that is much better than we were in the spring, no question about it. That also has meant the number of tests we're doing has increased significantly. The big frustration for us is, our residents bought us time of several months by staying at home and really tightening everything up. And in between, there still has not been any federal coordinated policy on testing. We're still seeing some issues with reagents. This should have been fixed in the few months, but it hasn't. One of the things we're seeing now is, as the demand for testing has increased, is that some of the big national labs are getting to backlogs. Not so much our local labs, right? I mean, the state public health lab is kind of at capacity. University of Washington is getting close to capacity, but we have other places locally we can send the test to where they still have capacity. But when you have these big national chains that send their labs to regional centers, and then you also have places like Texas, Florida, Arizona, where they're melting down and they're running a gazillion tests trying to keep up with their cases, it has caused backlogs at some of these national labs. So that is frustrating. And for the medical providers here, they should know that if they're having problems with their lab, they should get a hold of us. We can direct them to some of the labs that Department of Health has vetted and know that they have capacity, and help them make arrangements to get their tests to those places. But no question, we're in a better place now. I am just real concerned that as we head into the fall, we're going to run into the cold and flu season. We expect that COVID-19 will probably become more active at that time, but also there'll be a lot of other people with COVID-like symptoms who will need to get tested to make sure they do or do not have COVID. So if we're having challenges now, we're going to have more challenges in the fall. This virus is teaching us a whole lot, and we're learning new things about this, and we're finding some really bad things around this virus. It's kind of hard for me to point to any one thing I would have done differently at the beginning. I think we were fortunate that our healthcare systems and our partners were prepared. I think that when you look at the numbers, we fared pretty well compared to King County and Snohomish County. I think that, some of the things that we started out doing shifted just because our understanding of the disease shifted. And you brought up the issue around the masking. I think this is where there's a little confusion, in that we had such a shortage of PPE at the beginning. We were trying to tell people, please don't rush out and buy the PPE or the surgical mask, because the healthcare providers needed that. Okay, so I think people got that a little mixed up with the message that we have now, which, as you know, we're focused on face coverings. We still don't want people using N95s, and they don't even need to be buying up, paper surgical masks, right? So I think we just need to be careful about how that transpired. But I think that what we have learned since then is how important infection control is. And we learned that when we get outbreaks in nursing homes and long-term care facilities, that we should have approached it a little differently, because now we know that if we go in and do mass testing and implement cohorting, things like that, and infection control, we can keep the death rate down, infection rate down. So, one of the things that I wish we would have been able to do was, be more targeted in how we did some of the closures, and that I think the school districts in the spring would have preferred to have a little bit more time, because we were lagging King County. In retrospect, we probably benefited from, closing at that time. But yeah, there are just so many things we're going to be learning from this pandemic, and we're going to have to do a lot of debriefing and after action reports by the time this gets done.